For the last month or so, Richard Carter is a name that we've come to know and hear over and over again. He's been named as the COVID-19 pandemic Czar for Barbados. And so we've all been asking, what does that mean? Who is Richard Carter? And in true Bajan fashion, who he is, where he's from. We're going to get answers to all those questions and more today as Richard Carter, the COVID-19 Czar for Barbados, takes a few moments out of his busy schedule to have a chat with me. Welcome.
Thank you.
Yeah, I think the last time we met, we shook hands. We're not doing that today for obvious reasons.
No.
So let's get right to it, Richard. And I'm sure you can hear the Bajan question. Who he is and who he's from.
Yes. Richard Carter is 60-something-year-old, a Barbadian. Lived pretty much all of my life in Barbados. Came from a community that is partly enough rural, but enough urban to have had the mix of both. Born in an ordinary Barbadian family. Spent all of my educational life in Barbados growing up. And took on the responsibility, I suppose, when I first came to public notice of the Director of Youth Affairs in Barbados. So I did that job for about 12, 13 years. So I first came to, I believe, public notice when I took on the responsibility of Director of Youth Affairs, and actually was responsible for establishing the Youth Affairs Department as the first Youth Affairs Department in the island, and would have been pretty much in the public eye then, because the Youth Affairs Department was a very new and exciting time where we were trying to engage directly with young people. We did a lot of survey work, a lot of work on the ground. Our youth commissioners were out there. We were engaged with a lot of trying to move young people away from being seen as a problem towards being seen as an asset. Following that, I then joined the UK Department for International Development, so would have faded from public eye a bit, and then spent 4 years in Sierra Leone, actually working on the Ebola epidemic while I was there, because Ebola broke out about 6 months after I got there, and led the work on social mobilization and behavior change communication around the Ebola epidemic. One of the most satisfying professional times of my life.
How so?
It was professionally satisfying because we could actually see the behavior change. We plotted a number of knowledge, attitudes, beliefs, and practices surveys across the life of the epidemic, trying to track people's behavior. And we were able to see a change in that behavior. Over time, we were able to see that mapped onto the trajectory of the epidemic. So as people's behavior changed, so the epidemic reduced, or the levels of the epidemic reduced. But it was also professionally satisfying because you were actually and really saving lives in an environment where there is extreme poverty, there's a whole lot of social deprivation of all sorts. So it was really professionally satisfying to be able to put your technical training to direct use and to see results basically with the end of the epidemic. Following that, came back to Barbados and started to work again with the UK Department for International Development, working on the hurricane response and working on disaster risk reduction. And then COVID-19. And I was asked by the Prime Minister if I would join the team to take on part of the responsibility of working and supporting the government in its outreach. I believe that was prompted by two things. One, my experience on working with Ebola, which is useful because it is a pandemic, or was an epidemic, and it has a number of areas where you can read across. And secondly, because the Barbados response to COVID-19 requires a whole of government and a whole of society response, someone with a background of understanding the machinery of government, understanding the machinery of society, and I do come from a background of sociology, I believe that would have been useful. Hence, I was asked to take on the responsibility, and here I am.
Now, Barbados is not Sierra Leone, so I will assume that there are lessons learned and practices coming out of your Ebola experience that you are putting to use in this scenario, the Barbadian response to COVID-19. But there must also be some idiosyncrasies relative to Barbados only in this experience. So let's talk about that.
Yeah, so Barbados is not Sierra Leone by any stretch. Sierra Leone had 15% of its population had access to electricity. So that's a probably about 10% had access to running water. Probably more than 50% of the population would be illiterate. So those are things that you have to take into consideration if you're trying to reach people and execute behavior change. Sierra Leone had about 14 ambulances for a population of 7 million. So it's a very, very different environment. Barbados came to this with a number of advantages in the sense of a well-developed social protection system. We had a really well-structured healthcare system, and we were able to draw on healthcare professionals who have had experience in a variety of contexts, who are well-trained. We have a basic healthcare system that is reasonably enough diversified that people can access care within not too far distance. And again, we have a population that is generally speaking disciplined, a population that generally is responsive to direction. We have seen the variation from that, but that is to be expected in any population. Even in authoritarian regimes, you have situations where there's civil disobedience. But so there are a number of differences, and the differences have tended to be in the positive. It has made this response easier. And one of the big differences is Ebola had a mortality rate of about 80% when we started. So 800 out of every 1,000 people died. COVID-19, the mortality rate is around 3%, perhaps, maybe 1% if you take into consideration the fact that a lot of the people who get sick are mild. So that is like 1, perhaps to 30 in 100,000, in 1,000, which is a very different scenario.
Okay. Now, let us look at all of the moving parts for which you are responsible on a daily basis.
Yes. That is part of the challenge of doing the role. And I should say the title COVID-19 Czar it was a title that I would rather not have had and, because people have been bowing and doing all kinds of things. These are my friends. But I think the title or the role is essentially a coordination of the response across government and across civil society, generally speaking. Because, as I said, it does require a whole of government approach. So typically, my day would begin with getting briefings and getting information, catching up on emails that I would not have been able to see the night before or the morning before, depending on what time I got to bed. I try as much as possible to attend the Health Emergency Operations Center meeting, which is a standing meeting at 9:30 a.m. And that is where we get a lot of briefing in terms of what has happened the night before, in terms of testing, new cases, and in a couple of sad cases, new deaths. And it is also a strategy meeting where you plan and map out the strategy in terms of the evolving nature of the epidemic, because it is a very new, pandemic now. It is a very new pandemic. Then following that, there's almost certainly going to be calls to follow up with across government. There's a standing subcommittee of the cabinet, which basically meets again to discuss strategy and to look at the response as it is evolving. So how do we get food to people? How do we manage the challenge of crowds that we've been seeing in some places? How do we manage the range of governmental responses? How do we manage to reach out to those persons who are poor, who are elderly, to maintain levels of physical distancing while at the same time ensuring that the social protection measures that is necessary to keep them going are in place. Sometimes there is the need to do public media appearances, so I've now been thrust in the public eye again, much to my chagrin, but that is the reality. I think government wanted a bit of a consistent face of government in respect of the epidemic, and I've taken on that responsibility to try to communicate to Barbadians about what we are doing, what we are expecting. And then it is off to catch up on all of the emails I missed while all of that was happening, or all of the modern technology that is now flooding my phone with messages and WhatsApp messaging and so on. So it's normally a very hectic day with little space in between to kind of pause and reflect, and I tend to do that basically in the evening once I've gotten the meetings out of the way.
All right. Now, those were the easy questions. Here come the hard ones. Do we have this thing under control?
No, we do not. If we had it under control, we would be having 0 cases. So as long as there is an active case in Barbados, we have to constantly remind ourselves that this is a live operation, it is a live response, and we have to be on our guard to meet the constant evolution of the epidemic. What I will say, however, is that it has not gotten beyond our capacity to manage. So it has not outstripped our resources, either our human resources or our physical resources. And that is important because that is what has happened in many countries of the world. The epidemic has gone ahead of the capacity to respond. So you have more people needing respirators than you have respirators. You have more people needing critical care beds than you have critical care beds. You have more people needing to be admitted into hospital than you have those. More people needing to be tested than you have the capacity for testing. We are not there, and I do give great tribute to the government in terms of its forward planning. The planning for this started in January. There's a national preparedness plan for COVID-19 that was developed and approved by the cabinet way back in February. This was under preparation. So the work started very early, and we have constantly tried to keep ahead of the epidemic, even declaring stage 3 with the coming of a public health emergency a bit before other countries would have actually gotten there in order to maintain control.
Now, you say that, but we on the outside, some of us see a different picture. We see you say A today, but then by this afternoon, you may be tweaking that a little bit or sometimes retracting it. Last week it was the whole very public treatment of people being able to access food and other necessities within the deadline for the shutdown. There's a whole question of whether it's a lockdown or a shutdown and those hours. So the challenge of being under constant scrutiny, and in these times, constant scrutiny thanks to social media and other new technologies.
Yes, so that's a real challenge. I will say that any plan that does not allow for variation in a rapidly evolving situation like COVID-19 pandemic is a bad plan. So while there is a plan, there is the need to constantly evaluate that plan, evaluate the response to it, because although you know your society, there are behaviors sometimes that are exhibited that are inconsistent with what you are expecting or that are inconsistent with what people had done the day before. So if people basically follow the public health advice, then I think we are less threatened by the challenges that we see evolving. So even on the day when 24 or 36 hours notice was given of an impending shutdown of the supermarkets, even on that day, if people had basically still followed the public health advice, maintain 6 feet between yourself and the person in front of you, we would have had longer lines, but we would not have had the threat that was posed by people bunching together. And this is the same message that has been given from the very beginning and is being given today. One of the ways you protect yourself is to basically maintain that distancing, maintain respiratory hygiene, maintain hand washing, and so on. We welcome, I personally welcome challenge, I welcome constructive criticism, I welcome a variety of voices feeding into the mix, because nobody has a monopoly on knowledge, and in a situation where you're facing a new approach, a new epidemic, you will make mistakes, and you are subject to the widespread of knowledge that is available in Barbados. And I spoke about us being a disciplined, ordered, well-educated society. We have to take the benefit of all of that knowledge and information and throw it into the mix. Mm-hmm. What we obviously cannot countenance, however, and I've spoken about this a couple of times, is people using that education and knowledge and so on to destructive ends. So people who will go to the extreme of badging their comments with the mass head of legitimate public service agencies in order to create an air of legitimacy about fake news. Now, that is obviously something that is criminal, if you were to be blunt about it. But we welcome constructive criticism. We've had to change and course correct, and that is to be expected. Any government that has not changed and course corrected would be basically facing its own demise.
Now, another confusing aspect would be the directives. So you tell me to practice physical distancing, but then you tell me to stay at home. And once I'm at home, it's difficult to practice physical distancing because of the size of the home, the number of occupants, those kinds of realities. You're confusing me.
No, if nobody in your home is COVID-19 positive, then you are a family, you're within the boundaries of your household, then you are safe. It is when you go out of that household. So you have to imagine that COVID-19 is at your front door or outside your front door. When you step out of the boundaries of your property, it is in those circumstances that you practice physical distancing.
Well, then tell me that.
Okay, and I think we've said that. I think we've communicated that because obviously we are not. And perhaps, yes, there is some legitimacy that we have to be clear and explicit in our messaging and in our communication. We also have to be aware that we are communicating to several different publics, several different constituencies, not in the political sense, but in the kind of media sense and the demographic sense. And the messaging that we have been using for persons of my generation is not appropriate and would not work for persons of my children's generation. For example, I would say that a place was like Federation for persons in my generation. If I'm talking to my son, I would say it was Burst in terms of describing the crowds at the supermarket. So we have tried to do that to diversify our messaging, to diversify the media that we use, to diversify the influencers that we've sought to use. And perhaps there is a scope for a lot more of that now that we have gotten the message out about what to do. I think there is scope for a bit more communication as to how to do it and to focus in on the behaviors that persons need now to engage as the epidemic has evolved and as the requirement for behavior change has evolved.
Now, the other thing is that it must be a challenge dealing with a society that, by and large, does as it pleases, generally within law and order. I leave when I want to, I arrive when I want to, or when I have to. I go out and I get what I need to get. I come back when I feel like. All of that has changed under COVID-19. It must, well, have you considered it as a challenge for a society that has generally just lived its life?
Yes, this has been perhaps the most difficult aspect of what we've tried to do. We've tried to remind people that even when you yourself may not be at serious risk in terms of a young person, for example, who gets affected by COVID-19, we know that about 80% of the cases are mild, so mild that large numbers of people are asymptomatic or very mildly symptomatic, may not even know they have COVID-19. But you have a mother, you have an aunt, you have a grandmother or a grandfather. The risk for them is considerably elevated. All the deaths that we've seen of COVID-19 in Barbados are of elderly people. And in one or two cases, infected by persons, one or two cases of the cases that we have, infected by persons younger than themselves. So that is part of what we've tried to communicate, that disobedience to, and the natural tendency that some people have to try to flout rules. That is not just simply putting yourself at risk, it is putting members of your own family at risk. We saw from very early, as soon as the restrictions were announced, videos emerging of young people stating their intent to disobey. And so that's a message we've tried to communicate to young people. Yes, you disobey, and yet you put your mother who is providing and putting food on your table at risk. You're putting your grandmother at risk, and try to communicate the messaging in that way. And there have been lessons. We talked about Ebola earlier. There have been lessons from Ebola. Under Ebola, persons were not allowed to touch their own relatives who died, because it was immediately post-mortem, after death, that the body was at its most infectious. So here you have a society that believes that if you don't send off your ancestor or your loved one in an appropriate way by washing and preparing the body, that body roams in the afterlife forever and torments you. How do you get people to a point where they don't touch their dead bodies, where they don't touch their children if they are ill? And that was a huge battle. And similarly in Barbados, we are asking people to do things that are not in their natural instinct. We are asking people to do things that is contrary to what they've had and enjoyed for a long period of time. We are fortunate to live in a society that provides us with immense freedoms, but those freedoms are the very things that something like coronavirus can exploit.
Right. Now, you tell me that most of us, most of the cases of coronavirus will probably just be mild. And there's a school of thought that if that's the case, what's the problem? Let us do as we please, continue living as we please, have the mild symptoms, overcome them. They claim it will build our immunity towards future episodes of COVID-19. Why not do that?
Yeah, do that.
Have you heard that?
Yes, I've heard that, and do that. And that comes up against the reality of refrigerated trucks being lined up in New York to take bodies. Do that and run the risk of hundreds of deaths potentially of some of our most cherished citizens. Do that and see the spiraling. I believe this week it is up to over 60,000 deaths that have been attributed to COVID-19. Do that and face a situation where our way of life that has now become increasingly restricted has to be, those restrictions have to be prolonged, because as long as COVID-19 is around, we are not going to be able to relax and get back to the way of life that we wanted. So yes, there are those options available for people if they please, because you can't compel human behavior. You can, and the law is there, and you can bring people before the courts if they flout public health regulations. But there are very stark consequences, and the same social media that people rely on to do potentially destructive things, that social media is showing us, even in advance of our own deaths here, people that we know and love have died in New York, have died in the UK, and now have died here in Barbados. And I'm sorry, but we are unlikely to have seen the last death in Barbados, because we have what I've described as a perfect storm of large elderly population, high levels of diabetes and hypertension, high levels of other NCDs that predispose persons to elevated risk.
Now, that comment may very well come back to haunt you. We most likely have not seen the last death.
I don't mind being haunted by this, because the reality is there that if you have large numbers of people who are getting ill with this disease, they are elderly, they do have diabetes or hypertension, they do have other predisposing conditions, the chances of them having adverse outcomes is much greater, and we've seen it played out. I would love to be proved wrong that we've seen the last death, but the reality that is before me, we have, at last count, 3 people who've had to be ventilated, and people are placed on ventilators if they're really, really ill and they're not able to breathe on their own. And many people who go on ventilators then are more likely to have those adverse outcomes. And we are discovering new cases as we've gone. We haven't seen the last case. So I would love to be proved wrong, but the reality and what I'm seeing before me tells me that we probably will have more deaths in Barbados. The medical services, and we haven't spoken about those, have been doing such a fantastic job in terms of protecting life and so on, but they can only do as much as what they're presented with. And if people are presenting with this disease very late, so we've had a couple people come to the A&E already with pneumonia, which means that they would have had to have been ill for some time before they presented. It is very difficult to save someone who is at that advanced stage of the disease.
Now, the other thing is the public response to instructions. Again, we are not accustomed to receiving instructions, do this, do that, without also receiving guidelines as to what to do. But we keep hearing what not to do. And there have been some complaints that we're not getting the other side of that coin. What should we do?
Yeah, so I've heard those comments, and we've taken them on board. I think you would have seen a bit of a shift in the messaging over the past couple of days, looking at what persons can do to try to help protect themselves, to protect their loved ones. But yes, more of that has to be done. It was important, however, to get the message out about what not to do, because that is how you protect yourself. So getting clear messaging out about distancing, about hygiene etiquette, about how you conduct yourself in public, about restrictions, all of that is really important to get front of mind, because that is how you protect yourself from the disease taking off. Then you can focus on what do you do in a circumstance where you are at home, for example, and bored, or in circumstance where you do have to go out, but you want to know how do you go about protecting yourself when you go out. I know that one of the things I've been concerned about, and I've spoken to someone in the cultural media about, is how do we engage our children, and how do we find creative uses of that huge array of talent and potential that is there to help mobilize that segment of the population in response to the epidemic. Because children have been on vacation for a while now. It is possible that that might have to be extended if we don't get over the epidemic. How do we engage our children? How do we engage our young people creatively? That is a bit about what you can do, and we are trying to get to that.
I know that you are dealing with issues that are coming up on a day-to-day basis, but have you also begun to look and possibly even advise on some of the measures implemented during this time that would still stand us in good stead post-COVID-19?
Yes, there are going to be tremendous legacy benefits from us having gone through this disease. Right now, in the midst of the disease, we are focusing a lot on the challenge of grappling with the disease. But already there are some tremendous potential legacy benefits that are being identified.
Like?
The whole thing about e-governance, the whole thing about working from home and flexible working hours, the challenges that we've had to meet and face in relation to how do you marry public health reality with social constraints in a way that allows both objectives to be met. How do you engage with your population and means of governance? One of the things I was doing immediately before taking on the role of COVID-19 Czar was working with the Thorne Commission on Local Governance and going out to communities and talking to them. I really wish that we had gotten this, that started and gotten that on board, because imagine a society where we had local governance to the extent that we had contemplated it, and how useful that would have been in terms of the decentralization of messaging and information and care for the elderly and care for people who are vulnerable. All of that world of possibility now awaits us post-COVID-19.
How has it changed you? My final question.
I don't know. And the reason why I don't know is that in the midst of things, there can be changes in the way you approach and deal with things, and there can be consequences after that only people around you see, and you yourself in the moment may not necessarily see. One of the things that my experience working with an international organization has taught me, however, is how to have a measure of detachment and how to basically create downtime for yourself. I've tried to respect that and maintain that, because that is the only way that you can get through the very challenging situation and huge demands on your time that you can actually have.
And a good time to say thank you very much. Richard Carter, the COVID-19 Czar for Barbados, taking time out of his extremely busy schedule to have a chat with us. Thank you very much for joining us. Stay safe.